So that brings me to some questions for Rhonda. So just as a point of reference, what we're doing with the CDC is trying to create some educational materials for primary care providers to recognize what looks like community-acquired pneumonia that might be a fungal infection. So when to think about that, how to do that diagnostic testing, and then how to support your patients, whether yourself, because it sounds like you've been really great at kind of taking charge of this and working with a team. But, you know, in some cases in rural settings, people might not have an access to an expert infectious disease physician. So as a primary care provider, what resources do you think would be helpful for you in recognizing these causes of what appear to be flu or community-acquired pneumonia, and perhaps even resources as you start to treat the disease?
One thing that I would say that here in Colorado is that we have a lot of snowbirds that go down to Arizona. And so I do think we have probably more awareness of fungal infections than maybe some other communities, other states, et cetera. But, you know, when I've never had a coccidioidomycosis patient before that I've treated outpatient wise. So with that, you know, going to the internet and, you know, finding those resources along with Kippi, like the Valley Fever Institute, Mayo Clinic, CDC. But the thing is that there's so much out there that it would be nice to, like the Valley Fever Institute, that was a great resource for me to be able to have things very succinctly acknowledged of, okay, this is what I can do. So I think as long as we know it's out there, it's a great, at least it's out there that we know to go to it. And I think that's the problem, is that we don't know where to find stuff most of the time. We're relying on up-to-date and these plethora of you know, systems of all this information, and it's very hard to succinctly identify what's necessary for treatment and for diagnostics and such.